slip this arm in there for me.
Your mental health is just as important as your physical health. All of us can have mental health problems. The NHS Highland Learning Disabilities team can help if you are having problems.
Your mental health is how you feel and how well you cope with things that happen in your life. All of us have times that we feel happy or we feel sad. These can be to do with big things that happen or sometimes just small everyday things.
Things that make us happy can be special events like a birthday, doing things with your friends, being in a relationship, or being with your family. Things that make us sad, anxious, or upset can be studying for a test or exams, someone dying, being lonely,
Who's that? Who's that? I've never seen it before.
or having an argument with your friends or your family.
Why are you wearing that little top?
Because it's my top, I'll wear whatever I like, because you can't tell me what I wear. So
It is normal for feelings like this to come and go, but when they last a long time, they can cause problems and you can become unwell. So, how do you know if you or someone you know is unwell?
There can be signs or symptoms that we can look for. These can be things like a change from your normal routine, acting differently, not being interested in things that you would normally do, a change in how you're eating. Some people eat more or you can eat less, a change in your sleep pattern. Sometimes people sleep more or don't sleep so well. People can feel sad or angry all the time. People can feel agitated all the time. People can think that strange things are happening. You start doing risky things like drinking or harming yourself. It might feel that life isn't worth living and you might have thoughts about ending your life or harming yourself.
If you feel like this, you need to get help. It can be hard to talk about your problems. People can be embarrassed or not want to talk about mental health problems, but you should talk to someone. Talk to someone you trust. Speak to your family, a good friend, a support worker, or your doctor. If you or anyone else is worried, they can ask someone from the Learning Disabilities team to see you.
Who can help you with those problems and talk through some strategies to cope.
Here, a nurse is visiting Laura at home.
Just relax. Okay.
The nurse checks Laura's physical health to find out what is making her unwell.
It tells you about the blood that's going around your heart. Just to make sure that you're healthy. Is that getting tight? Breathe normally, it's about to stop.
Laura's physical health is fine, so the nurse talks to Laura about how she has been feeling. The nurse is concerned about Laura's mental health.
When you talk about voices in your head, are they somebody outside telling you something to do things? Or?
Well, it's like a really young...
The nurse makes an appointment for Laura to see a special type of doctor called a psychiatrist.
That worries me a little bit that you feel like that, and maybe it would be nice for you to see one of our psychiatrists who can help you with those problems and talk through some strategies to cope with that and to make you feel better. Yeah. Would that be okay?
Yeah.
The nurse will go with you when you see the doctor. You can go with a friend, family member or support worker. The doctor will speak to you, to your nurse and to the person with you. They will also speak to you on your own.
And John, I'll let you have a seat on this one, please. And then you go ahead.
Thanks very much.
Okay, that's super. We will think about things like whether you need more support, different medications that might help, talking therapies, This is when you talk about your problems and you think about what you can do to help you get better. Other people who can help, like the occupational therapist or speech and language therapist, might also see you. Oh dear. And how does that make you feel?
Horrible.
It must do, yeah. And does that voice anything to do with the wanting to hurt yourself?
Yeah.
Is it?
Yeah.
It can take time for you to become better again, but the NHS Highland Learning Disabilities team will help you to get well and to get on with your life.